right. Welcome back from the break, everyone. Um, we have next up Greg Garcia, who will be joining us to talk about um, the private partnerships, developments in healthcare, cybersecurity, government policy, and the role of public-private partnership. Greg, are you here? I don't know
I've
if he
just
is.
uh, I've just re-promoted him to panelist. I'm not sure why he temporarily got put back as a not panelist, but he is joining now as a panelist.
Perfect. So, I think Greg Garcia is well known in the cybersecurity circles. Um, and it's my pleasure to introduce him this morning. He's the executive director of the Health Sector Coordinating Council Cybersecurity Working Group, which is the government recognized critical infrastructure. Uh, it has more than 470 healthcare providers, pharmaceutical and medtech companies. And he's been in the cybersecurity circles since 2006. So, Greg, welcome.
Thank you, Sandaria. Good to see you again, and good to be with all of you. Um,
Likewise.
I'm older than that bio suggests. I've been in cybersecurity probably since about the year 2000, so it's getting long in the tooth, but I've seen quite a lot, and it has evolved over time. Anyway, let's get right into it. So I'm glad to be here with Archimedes. I'm going to spend the next half hour first giving a fairly quick refresher for those maybe not as familiar with the Sector Coordinating Council. Um, Talk about some of our priorities, what we have accomplished so far, and then talk a little bit about the policy side. So, um, for those not as familiar, the Sector Coordinating Council is part of a public-private partnership framework that's been in existence now for 25 years. And there's a Sector Coordinating Council for every critical infrastructure industry sector. And our role in the health sector and the cybersecurity working group in particular is twofold. One is we are an advisory council to the government by law through the National Defense Authorization Act, the a series of presidential executive orders and other statutes which generally direct our government agencies to pay attention to what we have to say about protecting critical infrastructure, protecting our critical healthcare infrastructure. The other part of our mission is to be an advisory council to ourselves in the industry. Is how do we get better at cybersecurity? Um, how do we be more secure and resilient as a sector? And so we in the cyber working group really got organized in 2017, 2018. Very few members at the time, but now we're up to, as you can see here, just a video check. You all are seeing 2026 membership as I advance the slides. They're seeing that? Yeah, okay. Thumbs up. This is just our profile right now. The number of members, the voting owner-operator members, which most of you participating, I think, fall in that category, and a number of advisor companies that are not regulated healthcare entities but have significant expertise in healthcare and cybersecurity. And of course, we are a joint cybersecurity working group with government, so we have government in the membership. Um, our um, our membership is broken out by subsector. These are generally defined by HHS as core subsectors within healthcare, and this is how our membership shakes out. And not surprisingly, direct patient care, the health providers numerically are dominant. Um, as a council, we have a charter that stipulates the election. That's why they're voting members electing their executive committee, 9-member executive committee, representing all of the subsectors. And they are elected to 3-year terms, and they in turn elect our chair and vice chair, currently chaired by Abbott, Chris Tyberg, the CISO there, with Samantha Jocks as our vice chair, who will ascend the throne in a year or two to become our next chair, if she so chooses. And then as a joint cyber working group, we are co-chaired by our government partners from ASPR and FDA. Obviously, Suzanne Schwartz is a well-known institution in our field. So this is a good partnership. We meet with them. The leadership of the cyber working group meet with Brian and Suzanne and their staffs on a regular basis, monthly at minimum, but more frequently through email and phone and texts and what have you, just to be in sync, to coordinate and plan together where we can engage in joint initiatives, such as, for example, coming up in the summer will be a national cybersecurity exercise, healthcare exercise, and I'll talk about that in a moment. What are our priorities? The number one priority is implementing our 5-year cybersecurity strategic plan, which we published in February of 2024, 2 years ago now, after 18 months of work. And you can find this on our website at healthsectorcouncil.org. You can take a picture of that QR code. Basically what we did is look at what are the trends in the industry over the next 5 years, from 2024 to 2029. All of these 7 trends, not surprising to any of you, but it's really a way for us to frame and put into context what are the cybersecurity implications for changes, for trends in the industry that we need to be prepared for. When you sort of boil it all down, that 35 or 40-page strategic plan, it comes down to these 12 implementing objectives. This is our to-do list. This is what we conceived of as being necessary for us to address those 7 major trends in the industry. I just highlighted here just as an example, 3 objectives that attendees of this conference would be thinking about as medical device manufacturers or those within that value chain. These objectives are written at a fairly high level for a purpose, because every individual organization, every subsector, whether it's medical devices or pharma or payers or providers, and our government partners, each would look at these objectives and say, where do we fit in? What can we do to advance this objective, either internally within our own systems, policies, or operationalize them? And you look at objective number 1. Well, this is a lot what we're just talking about today. Secure by design, secure by default. This will continue to be a challenge and an investment imperative. So what Archimedes is doing, for example, is addressing objective number 1 quite directly. So this is the idea behind the strategic plan. So everything we do as a council, as a cybersecurity working group with our task group structure, is intended to address one or more of these implementing objectives. Every time we start up a new task group or a new initiative, which objective is this addressing? Just so we stay focused on it. And if we succeed, then we would like to be able to say in 2029, this is what cybersecurity for the healthcare sector looks like. That we have been able to raise our diagnosis back in 2017 from healthcare cybersecurity being in critical condition to in 2029 stable condition. And if we have a target future state and a easy and digestible way of characterizing success, then, or at least progress, this is what it would look like. Here's an example. And then I want to get to policy fairly soon. But objective number 10, as it's highlighted up there at the top, develop meaningful cross-sector third-party risk management. Some of you, I think, have participated in this objective, which was called SMART, the Sector Mapping and Risk Template or Toolkit. This was in direct response. It started in April of 2024, direct response to the Change Healthcare attack, where we asked ourselves, what are the other critical services, utilities, critical functions that the health sector depends upon? to successfully complete core workflows, healthcare workflows. Critical services like Change Healthcare, which, if substantially disrupted in any way, could have cascading and indeed catastrophic impacts across the health system. So we looked at that question through these healthcare workflows that you see in red here. There were 17 of them in total. It was a way of mapping out, and I've picked a couple here just for a quick example, since we're talking a lot about medical device manufacturing. This is a board game, and when you start the process, and this is obviously a very complicated map, and it took quite a while to go through, and many of you will undoubtedly have advice on how to improve this map. But you go from step to step to step, and in each one of those steps is some typically digital software, IT, communications, service or technology that will advance that workflow. How do we identify then what are the risks of any one of those critical services or critical functions? And by then identifying those risks, you can prioritize them and plan against them. I just have one of them. Okay, so this is an example, medical products manufacturing. These are available to you on our website. If you go to healthsectorcouncil.org, request these maps. The document itself, which was published last year, is the Sector Mapping and Risk Toolkit, SMART. The maps that appear in the document itself are redacted from having too much detail, as this map does. But if you're a legitimate user, you request through our website any map, any one of the 17 maps, we will deliver it to you. And they're being used now. So this is a good way for us to sort of track our core supply chain, third-party risk management, and in some cases, embedded risk management. Any systems or software that we are using that are our own, like as if rolling your own. So how we do all of this. So that's just an example of implementing an objective. And in this case, objective number 10. We are organized according to this task group structure. Again, I'm highlighting those task groups that are focused on medical device security. And new ones coming up, post-quantum cryptography and segmentation and isolation. We have stood up 37 task groups since 2018. And these are the 10, I think, that are active today. The task group stands up, determines its objective and its deliverable, and then disbands once it has published its work. But the model is the same here. You have industry co-leads, you have government co-leads. We have 40 to 100 organizations participating in any of these task groups, and typically working weekly. 1 hour meetings every week, real-time screen share over Zoom, screen share editing over Zoom, and the output is this. So since 2019, these are our publications, best practices, guidance documents, 34 of them as of today. Probably 40 by the end of this year. We have a number of artificial intelligence publications that are going to be coming out this year. 2 or 3 more in different areas that I won't go through now because time is limited. But these are all available to anyone. They're mostly in PDF format. And we encourage their use. They're free. There's no copyright. We are simply trying to get these best practices, which are written by the sector for the sector, trying to get them implemented across the ecosystem so that collectively we're going to be more secure and resilient over time, and that we can meet that end state of those 6 pillars I showed you in a previous slide. But you can see there under Secure MedTech, all of our publications are categorized by these core cybersecurity functions: manage risks, monitor threats, respond and recover, secure medtech, measure effectiveness. Every publication will have 1 or more of these identifiers at the top of the document, indicating which function or functions they address. So quite a lot in secure med tech, and this has been. I know we're going to be seeing from the next panel of discussion about how MDMs and HDOs need to engage in a sort of a shared challenge, shared responsibility model. I'm proud to say that the cybersecurity working group has been a very good forum for that, where we would bring together the medtech and providers to work through some of these difficult questions as to who's responsible, who's accountable for security of medical devices, not just out of the box, but as they age in the clinical environment, and has to do with vulnerability communications and patching and so many complicated issues that by bringing them to the table, they're more apt to listen to one another, to gain better mutual understanding. And with mutual understanding comes a spirit of compromise, and with compromise comes consensus. So that's really, I think, what these secure med tech best practices guidance documents embody. Because we really did have robust participation. We continue to have robust participation from both sides. And I know it will continue. What are our priorities now for 2026? National Cyber Exercise, I've told you about that. We are working with HHS, ASPR in particular, and with Booz Allen as the facilitator to develop the scenarios and the whole process. We want to build out our workforce development and rural health initiatives, and those two are tied together, because we know that rural health providers do have severe workforce challenges getting people to go out into rural areas, but particularly cybersecurity people, when they don't even have the resources to hire cybersecurity people. Emerging technology remains a critical issue as we think about artificial intelligence and post-quantum cryptography, and then the constant march of technology that holds great promise for healthcare, but also considerable risks that we have to be prepared for. And we're going to talk about public policy in a second. Shark Tank, that's just an idea of how do we move from PDFs, those 34 documents, how do we operationalize them? How do we automate them through software programs, through services that will make it easier for adoption and implementation? This takes some creativity. It perhaps takes some of our vendor members who would like to monetize some of our work in order to provide it as a product or as a service. From publishing house to project incubator is the idea. And then finally, public policy. Again, this is an important part of our mission as a, whoops, boy, how is that moving forward so quickly? It's an important part of our mission as an advisory council to the government, such that when we do offer these recommendations and best practices to ourselves, we need to communicate with the government about what they need to do to facilitate the achievement of those objectives. The government has a role, obviously, not just in policy, not just in regulation, but also in programs, grant programs, or other partnership initiatives that will assist us. And indeed, that's what the public-private partnership framework has rested on over the past 25 years, is this special relationship between our core partners. In this case, it's Department of Health and Human Services and FDA, and the Sector Coordinating Council. And so just looking at what's pending now, what is pending and what is in place. Many of you, of course, are familiar with the HIPAA security rule notice of proposed rulemaking that came out early in 2025. We had looked at that, and I think there was a significant body of opinion that said this is not ready for prime time. It is vague, it's heavy-handed, it's costly, and in many cases, it is not actually effective at cybersecurity. So we have a role in providing advice about that. Our core proposal is that let's set that aside and let's start a consultative process with the government to actually negotiate what constitutes good cybersecurity, not just among health providers, which is what HIPAA is pretty much focused on, is the providers, but the whole ecosystem, to include medtech, to include third-party service and technology providers, to include payers. This is an interconnected, interdependent ecosystem. So let's look at it holistically. And so we have this proposal for this consultative process modeled after the NIST cybersecurity framework process, which took place in 2014. And we can do that again, but do it specifically for healthcare. And of course, Garcia, many of you are focused on that. The incident reporting rule, which we're hearing is coming out soon. But there's quite a number of comments that they're still working through. Anchor CI it's not so much a policy issue as it is a facilitation of the framework. Many of you have attended meetings that are called CPAC meetings, Critical Infrastructure Partnership Advisory Council. That framework was terminated by the new administration, and it is to be replaced with this thing called Anchor. We don't know when it's going to be activated. I just got a question from a colleague this morning, said, well, given that there is no Anchor, there is no CPAC, what's your relationship with government now? Are you being productive? And my answer to that is we are the owners and operators in private sector. It is our responsibility to improve our security and resiliency posture with or without the government. We want the government to be a part of it. HHS is helping as best they can, given many other competing priorities. But ultimately, we are forging ahead. And by evidence of 34 publications today, with 40 by the end of the year, we're not slowing down. But bright opportunities like this national cybersecurity exercise that we're planning with HHS and other initiatives related to the Typhoon series or the Typhoon campaign of cyber threats against critical infrastructure. We are coordinating with them on that. So there's a lot of good news about that, but the news can be better. This administration, I think, has not shown the level of priority on cybersecurity that we would like. That may change, but for now, we have to forge ahead. Looking at those laws in green, I think you all are familiar with those. The bottom one, NDAA, National Defense Authorization Act, is really what in statute directs HHS to have this partnership with us, to work with us to identify systemic threats to the healthcare sector, and to work together to mitigate those threats. Cyber performance goals. We helped the administration with this, HHS, as they first came out. We understand that there will be a version 2, looking at the essential goals. And of course, must do does not mean must do by regulation, but good cybersecurity practices say this is the minimum amount you must do in order to have good cybersecurity. And enhanced, of course, would be once you have done the essentials, you can build up a level of maturity with the enhanced goals. So after a couple of years of these being in place, we're looking at how are they being implemented, what's the cost of implementing them, where might we need to pivot into other goals or remove certain goals based on an analysis of how we are getting beat, how we are prepared against threats. And so we'll be working with the administration on that, less as a policy matter and more as operational best practices. But the government has not withheld the possibility that in time some of these could become mandatory. And again, that possibility again points to the need for us to have this consultative process where we can actually negotiate, where we can tell the government what we what we know, what we can hold ourselves accountable to. Most effective cybersecurity controls that we can be held accountable to. And let's just start with all the best practices that we have already developed. Those 34 best practices either are saying these are the practices we are already doing, or these are the practices that everyone ought to be doing. Okay, then hold us accountable to it. So that's that linkage between policy and operations. And um, for all publications going forward, we're going to assess whether there are appropriate policy recommendations. If we're going to have 4 more artificial intelligence publications coming out on different areas like governance and third party risk, threat operations and response, secure by design. Are there policy recommendations we can make to FDA or to HHS that would facilitate the achievement of those AI objectives? But that said, we also have that bottom bullet on the right in yellow. I would recommend to you, if you want to look at how are we advising the government on a whole range of policy recommendations broken out by category 1 through 5 there, as you see. But if you want to boil it down to major recommendations, it's those 6 on the left. Really, it's 5. Of course, the 5-year strategic plan, government was with us in developing that. But really, the 5 is dealing with the underserved, doing better incident response together, holding third-party providers to a higher standard, perform a systemic health infrastructure mapping. That's the SMART I just showed you. And then the top, I've moved from the bottom to the top just to be different. So these are our major recommendations, and they will evolve over time as government policy changes, as our operational and threat landscape change. But I would just stress that this partnership is essential between industry and government. We know that regulation alone simply is not going to be able to evolve quickly with the rapid changes in both technology and in the threat landscape. Normal market forces alone be able to address these complex and evolving challenges. So we have to be more resourceful, more creative in tackling these challenges, particularly when we have an adversary, a set of adversaries that are nimble and creative in their own right, and just keeping up with them is a joint challenge. So I have come to the end of my time, and I'm happy to take questions with whatever time is left.
Thank you, Greg. That was really informative, and I'm glad to hear we are forging ahead. I think that's a good message for everyone. I think there's one question in the chat that I thought. Trying to look at the question. Yeah, it's from Jenny, I think. As you put out our policies or guidance in the best practices, do you anticipate issuing different guidances based on the organizational structure or hospital size? For instance, smaller rural hospital that have small in-house teams, use managed security services. I think that's a really good question.
Great question. Starting with one of our flagship products called Hiccup. I was not familiar. The Health Industry Cyber Practices Volume 1 is specifically for small providers. And that's in our library of documents specifically for small providers. And Volume 2 is for medium and large. We have additional work products, for example, On the Edge, the Cyber Health of America's Resource-Constrained Health Providers, where we interviewed executives from 40 different health providers, rural, critical access, small providers across the country in 30 states to to gauge their awareness, their management of cybersecurity, what it is that they need most. If they're going to be regulated, what kind of help would be meaningful to them. So we got a strong sense of that. And for every task group that we go forward with, for example, a new task group hasn't yet kicked off segmentation and isolation. Well, now there is a technical issue, but a very essential one. We are making sure that while the task group is being led by larger organizations, that we make sure we take into account how do we scale this downward for smaller rural critical access providers? How do you explain segmentation to them in a way that is practical and cost effective? So we need to be sure that for everything we do, that we have some component of a best practice that is usable by them. And you can see that through some of our previous documents. But that's just one example. So that's a good question. It's important.
Okay. Thank you very much, Greg. That was awesome and really good to see you. I think that leads us to the next session.
Thank you, Sundaria. Thanks, everybody.